Good morning everyone and welcome back to another video. It is my final video of clinical experience 1. I am so excited for this week because starting off today I get to go and observe some orthopedic surgeries. I believe a majority of them are going to be total knee replacements, but I'm going to make sure to catch up with my clinical instructor, make sure I get to the right place so that I can get some new scrubs, since they require different ones for the operating room, as well as just make sure that I get to the right place overall. So I'm going to get ready to do that right now, but this week is going to be jam-packed with lots of fun new experiences. Surgery today. On Tuesday is acute rehab, so the longer term acute care. On Wednesday is going to be the burn unit. On Thursday is going to be the NICU with the babies, and on Friday is going to be my last day on the orthopedic floor. So it will be super fun, and I'll keep you guys updated along the way. So I'll talk to you guys tonight after I'm done with surgery. That's orthopedic surgery day all done. Overall, it was a really great experience. I got out a little bit earlier than I'm used to on Mondays, which is great, but it was just really interesting to be able to see, one, the attending Dr. Hogan, be able to go through some of the procedures. And at first, especially being someone who's kind of outside of the medicine area of surgery, that, I had to get used to seeing lots of the incisions and all of the kind of movements that were going on within the operating room. But once I got used to it, past the first surgery, I ended up seeing, I want to say 5, it was between 4 to 6 surgeries. One was an anterior hip, total hip replacement, and the remainder were all total knee replacements. So I definitely got to understand the total knee replacement procedure pretty well, and it was just really interesting to see, from even before I see my patient as a post-op total knee replacement or total hip replacement, see exactly what their body's going through and everything, to kind of give some context into the recovery process and really be able to validate how much pain they might be able to be in, because it's not like the surgeries are nice. You have to, get through some things. You are cutting through some tissue. So it was a really eye-opening experience for me to be able to understand more of everything that's going on with my patient from beginning to end. So I'm very thankful for the opportunity that I received today. But now I am definitely just going to take a break. I sent off my initial videos that I made for my clinic project, so I'm just going to wait until my clinical instructor gets back to me on those to see if I need to make any changes or if they seem to be okay to go. But pretty much the rest of today will just be kind of reviewing a little bit of material. I've been trying to just kind of get back into school mode and review some of the neuromuscular, some of the musculoskeletal condition material that I covered within this past semester or two, just so that when we start classes up next week, I'll feel a bit more comfortable with that. So I'm gonna get on to that, grab myself some lunch since I didn't have any lunch yet. And yeah, I'll give you guys an update once I have another one. That is our acute rehab day complete. Overall, it was another great experience to be able to have. I thought it was interesting to be able to see some of the more complex pathologies like multiple traumas, just lots of different conditions where you really have to be creative in how you approach things. Multiple different extremities having different weight bearing precautions or different braces. So it was really fun to be able to see kind of how you work around those type of things, as well as the thing that I think I appreciated the most about acute rehab was just the interaction in particular between PT and OT, where I really saw the fact that they would kind of go back and forth. And since in acute rehab, you are required by insurance to be able to tolerate 3 hours of therapy, whether that be physical therapy, occupational therapy, sometimes speech and language pathologists, and to be able to make it through that. And it's just interesting to see how much the PT that I was observing kind of talked with their co-partner OT to really kind of solidify the things that each of them made sure that they needed to keep as a priority to get them towards discharge. So whether they were having really difficult time with sit to stands in a particular setting, say they're using a single crutch when they're doing it, and being able to take some of their time as an OT during the session to be able to do that, as well as sometimes in reverse where the PT would work on a couple of OT things that they could just integrate throughout the session to make sure that each of them could meet their goals while collectively utilizing those 3 hours, since it's pretty evenly split, 1.5 hours each for the most part. So I was just very lucky to be able to have that opportunity. Sadly, I have some bad news that I will only have 2 more days at clinic, the first of which is going to be Wednesday tomorrow, where I'll be going to the burn unit. And on Thursday, I was supposed to go into the NICU, but just because of some external circumstances, I will sadly not be able to go into the NICU, which is sad because I was very excited to be able to see exactly what the role of physical therapy is with babies, especially right after they're born. But even so, I'm thankful for the opportunities that I have already gotten, as well as the ones that I'll finish off the experience with, because then on Friday, I'll just get to have my last day on the orthopedic floor and just go over my clinical performance instrument and final words with my clinical instructor. So, well, it's disappointing that I won't be able to do it. I'm still excited for what's left and will take it head on. But I did talk to my instructor today, and she had told me that the videos looked pretty good overall. There's just one thing that I have to edit and change on one of them. So I'm going to make sure to finish that tonight. That way I can get that completely done and out of the way. And then the rest of tonight, I'll probably just spend doing some studying. So that's pretty much all for today, and I'll give you guys an update tomorrow once I'm done. It is about 3:30 and I am just finishing up with being on the burn unit for the day. I got to walk home with one of my classmates and kind of catch up. She's been on the neuro floor getting to experience that. So just got to catch up, see kind of her updates and what things she feels she's using. So that was a really nice conversation to have. But the burn unit today, it was definitely eye-opening. It was really interesting to just kind of see physical therapy's role in kind of preventing contractures, really working with wound care and making sure that the skin maintains its elasticity to be able to keep that range of motion going. So overall, it was just really cool to be able to see something that, at least in our content so far, I have not covered much material in that. I know that we're supposed to cover more of that, I believe, this upcoming spring. So I will have more information on that. One of the people that I was actually observing with is one of our instructors that we'll have during there. So it was great to have that connection and kind of really get an intro into burn care from a physical therapy standpoint. But it was also really interesting to just kind of meet some of the patients who were in the burn unit and just kind of see what they're going through, because I got to see someone who, at least based on all of the considerations and scoring that they use, was 98% burned based on, I can't remember the exact criteria, but pretty much everything on their body was burned in some way. So there were very few viable sites to be able to grab more skin from, to be able to do autografts. So a lot of it was just seeing some of those allografts that they use from cadavers or other materials. So it was just really interesting getting to work with that patient for pretty much 2 hours, 2.5 hours, with both PT and OT working together there, just kind of hearing the story from the chart review that we had. It was just very touching, and I'm glad that I had that opportunity. But that's all of clinic done for today. Tomorrow we're off since the NICU kind of fell through, so it will just kind of be a recovery day before my last day on Friday. But tonight I'm just going to work on a bit more review, preparing for classes that are starting next week, and just kind of having some fun for the evening since I'll have tomorrow off. So I'm gonna get to that, and I'll talk to you guys later. Well, it doesn't look like I've done that much today. I've just been doing lots of logistical things and getting ready for the end of my clinical experience. So last night you saw that I was making some treats. Those are some treats that I'm going to bring tomorrow on my last day for my ortho team, as well as hopefully as many of the people that I've been able to observe with throughout the hospital as possible. I'll try and take maybe some of my lunch break to deliver some of those treats to them. But I've also spent today, like this morning, I went and got an oil change and everything in my car, because I don't think I've told you guys, but I will be getting a new car this weekend. So I'm going to be trading the car out with my parents, who are being nice enough to help me sell that old car, and then I'll have my new car. So you'll see that coming up in the next video as I make my way out into Nebraska to do kind of that trade-off with my parents there. But outside of that, I've done lots of things today regarding like my hire as a research assistant, making sure that I'm doing all my background check and everything is submitted now. I've been working through doing my clinical performance instrument and getting that done, since I'll be going over it with my clinical instructor the second half of tomorrow, since the morning half I'll be doing treatment still, but then we're just going to finish off talking through everything, making sure we completed everything, and kind of sending me off. So today has been busy, just in a different type of way, but we've got a lot done. Tonight we're also dropping off the bunnies that we've been taking care of back at their owner's house. So I'm going to get them ready for that, and then I'll talk to you guys tomorrow on our last day of clinic. It is absolutely crazy to think that 8 weeks have already gone by with clinical experience 1, and I'm feeling so just in between right now of being so happy that I got to, hear some of the feedback from all of the other therapists and hear how they really enjoyed me being there and being a part of the team, and how I'm going to be a great physical therapist moving forward. But it's also so sad at the same time to know that I'm not going to be able to go back to this experience, at least until I'm able to look for a job and get hired and maybe get on the team again. But I am just so incredibly thankful for the experience that I have had at UC Health, getting to be exposed to acute care, as well as all of the different specialties I had the opportunity of getting to observe. It was truly incredible, and I feel like I very much have a passion and a place in my heart for the hospital acute care, acute rehab setting overall, especially after this experience, just because everyone there was so welcoming, everyone there was so kind with their feedback, helping me push forward and become the best person that I can be, both as a physical therapist and just as an individual within the care team. So again, I am so incredibly thankful for everyone who has made the experience that I just had one of the best experiences that I could have hoped for. So that is clinical experience 100% done. Tonight, I am going to go to work for 4 hours, and then this weekend will start diving into classes, because we're straight back at it on Tuesday. So if you want to see going back to classes, because we won't be in clinic, I believe, until January when clinical experience 2 starts, make sure to check out the video next week where we hop back into those classes. We're starting back up with anatomy part 2, where we're diving into kind of the abdominal region as well as most of the joints. And then we're also jumping into musculoskeletal conditions too, and neuromuscular conditions too. So it'll be jam-packed, lots of information to take in, and I'm really excited to get into the classroom, even though I'm sad that I'm leaving clinic. It will be great to learn even more to be able to apply the next time I'm out there in the field. So if you enjoyed this video, as well as getting to see my clinical experience as a whole, make sure to like the video and subscribe down below for even more down the road. Thank you so much for watching. This has been KB DPT, and I'll see you all in the next video.